say it's very nice that we have a lot of cooperation from a number of medical doctors and oncologists in town. In fact, certain oncologist who is the head of a oncology center that's apart from the main cancer group in Vancouver. He is so open-minded and so cooperative. Sometimes I actually run into tumor marker panels for him when the system does not allow him to order these tests. And in fact, in order to treat cancer, I believe that we should take a very, very practical approach with the patient's welfare, patient's well-being, patient's quality of life, and practicality all in mind. And at times I do believe that chemo has its place, and I do believe that when we need to move in with heavy guns, as long as we have all the backside covered in terms of supporting the immune system and the detox mechanism, and I still feel very strongly that it has its place, and debulking in certain cases, such as using surgery to decrease the tumor load in a hurry, definitely is very, very important. And in fact, there is really nothing wrong with radiation. We know that it might be bad, but then again, for local control and then for palliative treatment, it definitely has its place, except there are certain things that we need to do to alleviate the side effect, and also by understanding what radiation is doing, we need to do things to have it covered. For instance, recently, we have a very wonderful patient who has mesothelioma that was a result of asbestos that he was exposed to in the past. And we know that there's really no good treatment for mesothelioma. However, we managed to cooperate with this wonderful oncologist. We put him on cisplatin and gemcitabine, even though it was meant to be a trial. We didn't really expect that much out of it. Of course, when I treat a certain cancer patient, we don't have any protocols, I don't have any cookbooks. We always start from scratch. We look at the patient very carefully. We do a very thorough history taking. We will take the family history, work history. Sometimes I even have to go back to whether they were breastfed or not to find out, to speculate what their immune status might be. And I have to go through a lot of timeline questioning in terms of what kind of stress was the person subjected to figure out the timeline in terms of how come the cancer occurred. Anyways, and then we'll go ahead and individualize very carefully and have all of the basics covered in order to go ahead to not only attack the cancer but also to support the system to help us fight. So in this particular case, of course, we did all the workup first. So oncologists kind of gave me the signal and say, okay, Jim, I think I'm going to try this. I say, gee, it's not going to do very much, but what else is there to do, And I talked to this guy. He said, no, Jim, I just want to give it a go. He's a young guy in his early 50s. And so we did all the workup. I had him all prepared for the chemo. We move in with the chemo. We monitor him very closely between the oncologist and myself, and we co-treated the case. Surprise! The PET scan actually showed no cancer activity. Actually, this is a workman's compensation case in the American sense. It's an L&I case. Everything was paid for by the government, and the doctor from WCB, that's the workman's comp, or the L&I board, was so surprised. They paid him every single bit of the expenses for a panel in UCLA to go over the case to see what happened because of the surprising result of the PET scan being totally negative. A PET scan, by the way, is a way to track down cancer activity without having any formation of tumor. It's a way that they will inject a little bit of glucose into your vein, and this and these glucose molecules are being labeled with a little bit of radioisotope. These are very weak radioisotope that is so unstable that it will be gone in 24 hours time. So they have to prepare the reagent literally only 24 hours before you go in. So it's very safe. And so after they inject this radioactive or radioisotope labeled glucose into your vein, they will go ahead and scan through your entire body to look for a higher concentration of these radioisotope, assuming that there's a higher uptake of the glucose molecules by the cancer cells or by the more active cells. Of course, you have to, take into consideration certain areas of your body that would have a high uptake of the glucose, such as our brain, our heart, and also, of course, because glucose is excreted very fast, and this radioisotope is excreted very quickly from our urine, and the bladder is always going to glow. Anyway, so basically by tracking down where are the high uptake of this glucose, you would suspect where the cancer activities are. Sometimes you can find cancer cells without the formation of any tumor yet. And I wonder if anybody knows that a cancer, by the time it gets to 1 centimeter in diameter, which is the clinical detectable limit of most of these imaging techniques, including MRI and CT and ultrasound, there are 1 billion cancer cells in it. And in fact, anything smaller than half a centimeter, we usually have a hard time detecting them. And PET scan is something that is very useful to detect cancer activity before the formation of such a tumor. And the fact that it's negative, in this particular case, it really threw a loop. And it really opened the eyes of not only in the oncology field in Vancouver, even in UCLA, they're saying, hey, what's happening here? Maybe we have to do something into looking into alternative medicine and complementary medicine. And in fact, it's very exciting. In fact, Dr. Jerome Block, MD, who had been the head of oncology at UCLA Harbor, that's the medical school in UCLA, he had looked into my practice for a number of years and became so interested that he, in fact, has certain plans to go ahead and incorporate complementary medicine, perhaps in the UCLA Oncology Center, which is very exciting.